Hello, everyone. This is Mohammed Abbas. I'm a postdoctoral research fellow at Faculty of Business and Law, Queensland University of Technology, Brisbane, Australia. Today, the topic of my presentation is COVID-19 highlights the unworkability and unsustainability of Canada's access to medicines regime, CAMR, and analysis. And it is important to acknowledge that this paper was published by the South Center, Geneva, Switzerland. And I presented this paper last month at the Creative Commons Global Summit. This is my presentation overview. I will touch upon the COVID crisis is a global problem. Patents as barriers to access, compulsory licensing, and Article 31 bis or export-oriented compulsory licensing, Canada's access to medicines regime, CAMR, the Bolivia Biolease case, and the TRIPS waiver proposal, and I will conclude. The COVID-19 crisis is a global problem impacting everyone, no matter where they live. The pandemic has claimed more than 4.8 million lives and caused significant economic harm. While COVID-19 poses an equal threat to all countries, their economic resources to deal with the pandemic are not equal. Very early in the pandemic, many richer nations used their economic might to conclude pre-purchase private deals with vaccine developers, while leaving poorer nations at the mercy of charitable donations and optional goodwill of big corporations. As of October 20, COVAX has shipped only 378 million COVID-19 vaccine doses to 144 countries, leaving vulnerable populations in poorer countries unprotected. So the poorer countries, they are scrambling for vaccine doses, while the richer nations, they have the control, the corporations, they have the control over supply and oversupply of COVID-19 vaccines. And I will discuss the role of patent law or the patent protection in which is causing barriers to universal supply of COVID-19 vaccines. Patents are private exclusive rights that allow patent holders to control whether and on what terms the protected items can be used by third parties. Patent protection conflicts with reverse engineering and manufacturing of patented drugs and vaccines if such activities are carried out without the right holder's consent. Patents therefore provide the desired tool to patentee corporations to dominate the market and derive maximum profits by excluding others during the term of the patent. The production capacity of a handful patentee corporations does not meet the demand. The reluctance of patentee corporations to share their technologies has been a key barrier in utilizing the vaccine manufacturing facilities around the world. Patentee corporations tend to leverage their strong bargaining position resulting from exclusive patent rights to further extend their tight control by negotiating favorable contractual terms. For instance, Pfizer has assumed the power to block countries from donating their COVID-19 vaccines to other countries. They cannot sell, donate, or transport Pfizer vaccines without patentee corporations' prior approval. This is against the doctrine of first sale or exhaustion. Once you sell your patented product, you should lose control over that under law. But Pfizer is using the contract law to negotiate these terms. Pfizer has assumed the power to unilaterally change the vaccine delivery schedule without suffering a penalty. Pfizer has even demanded that public assets be used as collateral. Several countries like Brazil, Chile, and Colombia signed contracts with Pfizer waiving immunity against patentee corporations' precautionary seizure of any of their assets. Under-resourced governments having no real alternatives submit to unreasonable demands of a handful patentee corporations. Compulsory licensing under the TRIPS agreement. A compulsory license is an authorization given by a national authority to a person without or against the consent of the title holder for the exploitation of a subject matter protected by a patent. A compulsory license can be issued for use by the government by its agents, which is called ground use, or by third parties, including corporate bodies. Though the term compulsory licensing has not been used in the TRIPS agreement, a set of conditions have been stipulated under Article 31 of the TRIPS agreement for grant of a non-voluntary license. Article 31F of the TRIPS agreement stipulated that the use be authorized predominantly for the supply of the domestic market of the member authorizing such use. So this was a serious restriction on the use of compulsory licensing for the countries that are lacking their own manufacturing capacity. Because of the condition of the domestic market, the developing and least developed countries lacking drug manufacturing capacity could not take advantage of the compulsory licensing flexibility provided under Article 31. Under paragraph 6 of the Doha Declaration 2001, the Council for TRIPS was instructed to find an expeditious solution to this problem. WTO General Council's decision 2003 waived the domestic market condition provided under Article 31F. Article 31 bis was inserted in the TRIPS agreement to provide the legal basis for export-oriented compulsory licensing. In November 2003, Canada announced its intention to amend its patent laws in order to implement the WTO General Council's decision or Article 31 bis of the TRIPS agreement. In May 2004, Canada passed Bill C9, which was originally named as numbered as Bill C56. The Jean Chrétien Pledge to Africa Act received royal assent in May 2004. This act provided the legislative framework for Canada's access to medicines regime, CAMR, which came into force in May 2005. The Liberal government clearly described CAMR as a humanitarian initiative aimed at addressing public health problems afflicting poorer countries. In 2007, Canada authorized Apotex to manufacture HIV/AIDS medication Waiver to export to Rwanda. In the last 16 years, this is the only export-oriented compulsory license granted by Canada under its CAMR regime. Now I come to a recent case study, the Bolivia biolease case, which highlights that patents are causing real-world barriers in accessing COVID-19 vaccines. Bolivia, with a population of around 11 million, is a small developing country in South America. Bolivia faces the challenge of poverty, inequality, and precarious work as its labor market is dominated by informal work. Bolivia, having a weak health system, was not prepared for a health emergency. Bolivia has low rates of vaccination as doses of vaccines are coming too slowly. In February 2021, Bolivia self-identified as a country wishing to purchase up to 15 million doses of COVID-19 vaccines from a Canadian firm, Biolease Pharma, subject to the grant of a voluntary license by Johnson & Johnson, or the grant of an export-oriented compulsory license under the CAMR system. Biolease Pharma is a fully certified biologics manufacturing facility having the potential to produce up to approximately 200,000 vaccine doses per week. On March 3, 2021, Biolease Pharma wrote a letter to Johnson & Johnson to request a voluntary license to manufacture and export its viral vector COVID-19 vaccine. Johnson & Johnson rejected the request for a voluntary license and refused to negotiate. Johnson & Johnson's one-shot vaccine is the best solution for low and middle income countries because you cover more patients with the number of doses you have. It's just one shot solution. And it doesn't have the temperature requirements like Moderna and Pfizer vaccine. You don't need sub-zero 30 or minus 30 or minus 70 temperature for J&J vaccines. So it's the best solution for the under-resourced countries. It was unfortunate that Johnson & Johnson refused the voluntary license and refused to negotiate. Schedule 1 is a list of patented pharmaceutical. So the CAMR regime has an additional requirement of Schedule 1 that the product should be first included in the schedule, should be listed in the drug list, and then you can go for the compulsory license. This was not required in the paragraph 6 system. Canada provided this additional requirement, additional step to please the brand name pharmaceutical industry. Schedule 1 is a list of patented pharmaceutical products that are eligible for export under the CAMR system. On March 23, 2021, Biolis Pharma requested the Minister of Health and Minister of Innovation, Science and Industry to recommend the Governor in Council to add the COVID-19 vaccine to Schedule 1 of the Patent Act. Since then, for well over 200 days, Biolis Pharma has been hamstrung by the first step in using CAMR. The process to amend Schedule 1 lacks transparency and certainty. Representatives for Biolis Pharma had meetings with more than 30 different high-level government officials, but still have no straight answer on how to start the process. Before adding the COVID-19 vaccines to Schedule 1, the Canadian government is questioning the capability of Biolis Pharma to manufacture safe and efficacious vaccines. Even if we presume that Biolis Pharma does not have manufacturing capability, it does not provide a legal ground for not amending Schedule 1. There were already products on Schedule 1 when CAMR received royal assent in May 2004. None of these products was at any stage of development by any generic manufacturer. Number 2, Schedule 1 has been amended 3 times. In the past, in none of these instances, applicants were asked to demonstrate their manufacturing capability. Number 3, it is not practically viable to ask Biolis Pharma or a generic manufacturer to invest over 10 million and assume all the risk with no guarantee that the product will be added to Schedule 1. So it's not practically feasible. The CAMR process includes a Health Canada review of the application, but this step is after getting the product added to Schedule 1. It's not before adding the product to Schedule 1. Once Schedule 1 is amended, a review by Health Canada can be completed either before or after making an application for a compulsory license. Biolis Pharma is willing to use its commercially reasonable efforts to obtain the requisite Health Canada regulatory approvals. After nearly 6 months of effort, Biolis Pharma has not been able to even get the CAMR process started. Further delays are foreseen, but unwarranted delays during a health emergency seriously undermine the public interest. Another approach would be Canada and other high-income countries supporting the TRIPS waiver proposal. The TRIPS waiver can then facilitate export of COVID-19 vaccines to Bolivia and other less resourceful countries. Canada has been non-committal and has a wavering position on the TRIPS waiver proposal. There were contradictions and inconsistencies in the position of Trudeau's government. Trudeau at times said that he's very keen on supporting international access to vaccines, but other times he seemed unwilling to follow through with concrete actions. Trudeau emphasized that this pandemic will not end anywhere unless it ends everywhere. I can assure you, Canada is not interfering or blocking anything and is very much working for a solution that benefits everyone, Trudeau said. At the WTO, Canada is insisting for evidence to be convinced of the need for the TRIPS waiver, that IP rights pose a genuine barrier to accessing COVID-19 vaccines. At home, Canada acted swiftly without waiting for the evidence to accumulate to equip itself with legal tools to temporarily override IP rights. On March 24, 2020, Canada rushed to amend its Patent Act under Bill C-13, entitled the COVID-19 Emergency Response Act, to make it faster and simpler for the government to grant a compulsory license. This legislative change was made very early in the pandemic when less than 30 people had died in Canada due to COVID-19. There was no evidence of any specific barriers posed by patents at that stage. The Canadian government argues at the WTO that the TRIPS waiver is not required because the existing flexibilities in the TRIPS agreement are sufficient to address supply problems. On one hand, Canada is asserting that the existing mechanisms are working as intended without any difficulties, while on the other hand, Trudeau's government has stonewalled BioLease Pharma's legitimate attempt to use the camera mechanism. These contradictions make it hard to comprehend Canada's position on the TRIPS waiver. Let me conclude this discussion. It is in our collective best interest that COVID-19 vaccines are distributed equitably across the globe. Instead of trying to hide behind the legislation, the Canadian government should consider amending Schedule 1 of the Patent Act without any further delay. Canada needs to reverse course at the WTO by publicly announcing its support for the TRIPS waiver proposal. Canada's confusing position of not blocking the TRIPS waiver while not supporting it either lacks legal clarity. As the WTO works by consensus, legally speaking, Canada will keep blocking the proposal until it agrees to support it. I would love to have your questions and comments. You can note down my email ID. It's mohammed.zahir.abbas@connect.qut.edu.au. Thank you so much. I'm looking at the chat box if I have any questions or comments. Yeah, Professor Matthew Rimmer has asked a question that whether Canada should support a broad TRIPS waiver or the narrow version of the TRIPS waiver as supported by the Biden administration. I think we need to go for the broad version of TRIPS waiver because COVID-19 vaccines are not the only problem. We need other technologies, COVID-related technologies. And to protect the public interest, we need to advocate a broader version of the TRIPS waiver proposal, and it will be good if Canada supports the broader version. There's a question, but it's not in English language. I'm sorry, I can't understand. In the Q&A, there's a question, but it's in some other language, maybe Spanish. I'm sorry, I can't understand that. Okay, what is your position on CTAP? Yeah, my position on CTAP is very clear, and I have advocated for CTAP and in my previous presentations that WTO member states and big corporations, they should support CTAP for sharing of know-how and technology. But what happened actually, not a single big corporations, they supported CTAP. And even it lacked support from the WTO member states. Even the developing countries, they haven't supported it in overwhelmingly, and which was unfortunate, and it hasn't delivered the desired result. It was a very good idea put forward by Costa Rica, and but it couldn't gain any traction because of lack of support from the big corporations and from especially the economically advanced countries. It could be a good solution if countries had supported it and corporations had shared their technology and know-how. We would have been in a much better position if it had worked. And it is unfortunate that it couldn't gain much traction. Okay, thank you so much for having me. And I appreciate the organizers of this conference for providing me this opportunity to share my research findings. Thank you all.